Somebody was wondering what subtle anatomy is, and Corrina and I thought that it would be a good idea to do a film where I'm explaining it a little bit more so you get an understanding, a little bit deeper understanding for the body and how wonderful the body is put together. So I'll start out by having a question: what is subtle anatomy? Well, we have the gross anatomy, which is the muscles and the bones and the joints and the big parts of the body. And then we have more subtle anatomy, which deals with nerves and capillaries and fascia and fluid and just things that are very small in the body, very subtle. We don't always feel them, but they do have a big impact on the body. So the subtle anatomy is the fascial structures primarily, but it's also how the muscles work when there's little twisting in that fascia or misalignment of the structure of anything in the gross anatomy. So when I am talking about, and the course that I put together to help people that are interested in practicing this kind of work, a subtle anatomy course, it's because there's times that you may have your hands like, say, here and here, and you want to have some correction going on here because it's not correcting by using the gross anatomy. Then you come into the subtle anatomy and you find that system or that feeling of the subtle anatomy, and you don't use a lot of pressure because pressure will make it just disappears under any kind of pressure. So you would just hold it and wait until you find what it is, and then it'll start to move and correct itself. It could be the fascia that's pulling a little bit of the skin out of place. It's always very small and very subtle. So the subtle anatomy work has to be done slowly, and it has to be done subtly with very, very little pressure on it. Sometimes it's less than 5 grams, sometimes it's a little more than 5 grams. So just what I was doing here, I could feel small structure changes in this little section of vertebrae right here, which is a little bit of the thorax, the very top part of the thorax. Thoracic vertebrae, to be more precise. So the subtle alignment is different from massage because when you do massage, you're working strictly with muscles. Massage is myotherapy, and myo means muscle. And so when you're working with massage, you're getting into the muscles, okay? And you're working the muscles, which is good. Primarily, you're getting circulation moving to the heart, which is why you always want to put more pressure toward the heart, especially when you're on the limbs of the body. And the misalignment, the subtle misalignment would be the twisting of the fascia beneath or on top of it. In this case, it would be on top of the muscle. The fascia oftentimes will also be, kind of in the muscle, between the muscle and into the, it just is everywhere. It's all around the organs and everything. So that's the difference between subtle alignment and massage, is if you massage somebody and they're, they have this misalignment of these bones, massage will not necessarily address that subtle part to be able to correct that subtle part. And the subtle part is what is deeper into the body. It's smaller into the body, and it's actually more to the core of what the problems are. Not always, but more often than not. Massage is basically used to relax people down or to help soften muscles, but softening the muscles to, like with sports injuries and that kind of thing, you can always almost always find that there'll be something going on at the subtle level as well. So they work together with each other, but they're very different. And that's why I feel personally why the subtle anatomy work is so important, because when I feel something out, like they have something going on in their knee, and I can find it with the misalignment of that little cuboid bone in the foot and the tibia fibula joint right below the knee, and correct that will correct a lot of things. It'll correct also along the muscles that are more gross anatomy. You can take the massage techniques and then kind of iron that out, because underneath that, the alignment part is going to be corrected, so the muscle will be able to be ironed out really well. Some of you might be wondering what the fascia is. The fascia is like a big web that we have throughout our whole body. And the web is what holds everything in place, basically. But you have to think about that web. When you just move your hands, just like that, or you move your head or your back or anything, the fascia it's a web-like structure. It has to move with that to give you a stretch or a turn or whatever. Now, what's so interesting about fascia is that when it's in its right place, none of the webs will ever touch. It doesn't matter how complex the movement is, the webs don't touch. And that's what's so phenomenal about it. Because you'd think with that much webbing that it would definitely touch if you're twisting it or bending it, but it doesn't. Now, what happens when there's dysfunction in that is the webbing will start touching each other, and then it'll get caught and maybe hung up. And that's where you feel the unwinding part happening. It's at that fascial level, but it was made that way because of something else that pulled it out of direction, maybe, falling or something like that. But it's actually the webbing that you're feeling under that little tiny pressure that you're finding to help correct the fascia. And the fascia we don't know how the fascia is going to run, so you can't really, force the fascia in any direction. And that's why the work has to be done very lightly, because the fascia has to find its own way back, and it has to unwind through whatever pathway and trajectory that it made to go into that dysfunctional position. It has to back out from that, and it has to back out from the most recent webbing that was caught and back out little by little to the first one. So it starts from the most recent to the first one, which is why sometimes it takes a while for those things to work out. So how does this help the clients out of pain? Well, if you've got a problem and the webbing is twisting in some way and all this pulling, it's going to pull all the way on all the fascia in the body at some level. So if there's a really stiff neck going on, and the neck is just stiff and you can't turn it one way, a lot of times you'll feel pain maybe down the shoulder, maybe into the clavicle, around the neck in a different spot. It's because the fascia is getting pulled into, clumping together with the little webbing, and it has to be unwound. Oftentimes when I'm working on somebody, there'll be, like, let's just say a stiff neck, there'll be like maybe their hip will jump, or their foot will jump, or their shoulder will jump. And what that is that's where the fascia was also twisted to a point that it was holding that down and making that actually worse, even though it wasn't directly what was hurting. It was just another part, but it was holding it down. So if this part is distorted this way, it's also going to distort all of this around, because all of that has to follow it, because it's like a cobweb, only really tiny. So you have to get to where, like out here, you could start to unwind it, and as you unwind it on the outside, it's going to take and unwind all the way through the inside. So you don't necessarily have to be on the point of pain, because it will work out, although eventually, if you're working with it, it more often than not, it's going to want you to be on the point of pain as well, because that's where the biggest amount of knotting and where the webbing is attached to each other. So it will work you maybe from the far distance of it and then work your way in. And then when you get on top of that, then you feel all that undulating and movement, which I'm doing, but I'm exaggerating because I'm not really feeling this. But you will feel that at a subtle level to where you don't really see the hands moving, but there's a lot of activity going on into that fascial structure. So if the fascia is twisting and there's a dysfunction there and it starts twisting, like say this way, then all this other parts out here and down and all over is going to also have a particular drag on it. So you oftentimes will start down lower and you'll feel things letting go, and then you'll be moving farther into the center of where the initial problem is, where the pain point is. Now, muscle knots are more often than not more like a fascial restriction. Unless you fall and you get bumped and might be, some kind of bruising going on, that would maybe bring something else, but there would also be fascial dysfunction. So muscle knots are very, very tense muscles, oftentimes hung up because of the fascia. Not everything that is going on in the muscle is necessarily a knot. It could be something else, but if it is a more muscle knot, and you know it is because you can feel it, you'll also, if you take note, you'll feel that the muscle is also very, very tight. And that's another suggestion that the fascia is like really being pulled in a way where it's not being pulled in a good way for just like a regular stretch, but it's been maybe overstretched a little bit. And so the muscle gets tight because the stimulus is just going to hold it in that tighter pattern. So the misalignments would be when there's a pulling or something that happened, a sleep crooked and the neck is out. When there's a pulling happening, that is what you would consider a misalignment, and it can pull into the more subtle parts, which is the structure, because these little joints in our body, big joints too, but little joints particularly, they'll get out of structure because they're easy to move out of structure. And that will be what a misalignment is. A misalignment is when the vertebrae should be going one on top of each other, but you find that the vertebrae is going one on top of each other, and then there'll be a little slight to the side and then come back in. That would be considered a misalignment. Down in the foot, there's the cuboid bone, and that one oftentimes will get misplaced or out of alignment. The cuboid bone will relate up to the tibia and fibia, the joint right where they are close coming together. So there would be 2 points of misalignment. One is in the foot and one is in the joint farther up, right under kind of to the side and underneath the knee. So it would be more laterally on the leg, but it's right below the knee. How does subtle alignment help people to relax? When that little stuff is happening, it's profoundly relaxing. It's something that we don't always feel, particularly when a person can just close their brain off and not think of anything out there, nothing at all. Just let if the mind wants to have some thoughts going through it, just let it pass like a movie screen. If the mind, rather than having the mind think of something that's out there and then you're kind of using your mind. I'm not sure about this, but it would be more like the difference between left brain and right brain. When your left brain is operating, that's the logic side of the brain. And so you would be thinking it through, you'd be connected into that part, and you would be thinking things like how to figure this out or that out. But the right brain is the more creative side. The right brain is where creativity happens. And so if you just would allow yourself to go into the right brain, it will bring things up. It may process emotion. It will just bring things up that your left brain isn't really there to function with. It's why it's important to have a balanced left brain and right brain. And what's happening now in the education system is the left brain is being overdeveloped and the right brain is actually being underdeveloped. And that's why there's so little creativity and so hard for people to understand concepts of different tones and vibrations and how that will affect the cells and the tissues, because that's going into a deeper level where your mind has to think a little bit more creative in how that's working. And at the same time, the left brain has to also begin to interpret it in a more logical way so that it's understood. So we do need good brain balance as well. And so the subtle anatomy, when you're into the subtle anatomy and your mind is just thinking about nothing and you're just laying there in kind of letting the energy of your body and the connection between the mind and the body happen, what will then occur is that you're actually connecting into the body. The mind has great power over the body, and you can talk to the body and let it heal, help it to heal, because the body can heal itself if the mind is going to be in the right place for it to happen. But it's not going to be in the right place if we have different emotions like fear, or we just think it can't happen, or we're in a lot of anxiety, then we're going to be interfering with the connection between the mind and the body, and actually more the right brain, because there's too much busyness going on. And so the mind will override the body, and the body will just continue to be the body. And that's really, to me, that's where the trickery has happened, that people aren't taught or don't know about connecting to their body with their mind in a good, nice, relaxed way. And that way, when you're in that space, then that's when your body can do what it has to do to heal. When they're in that space, that's when you, with trained hands into the subtle anatomy, can feel the movement that's happening as these small parts, these subtle structures are correcting and making things go to the right place. You want to always remember that the body wants to be well, it wants to heal, and it wants to be in the correct positions. If you are practicing massage therapy and you want to go deeper into it, that's how you will get much more effective at what you produce with your work. And that's how the body of the person that you're working on will be able to get themselves into a corrective pattern and just feel better all over the place. They'll feel better physically, they'll feel better emotionally, they'll feel better mentally, and then begin to deal with the emotional body and the other things where we can even bring ourselves up to being a very powerful human being. Because when all this is said and done, we just don't have any clue how powerful we humans are, because we've been put into such a space of fear and anxiety. I want you to understand that no matter where the pain is in the body when they come in, when you can get down and access that subtle anatomy, you can help them to heal. So it's important to help them relax through the subtle anatomy instead of just at the muscular level, through the quieting of the mind. And that way you get the difference in real effective work, and also give the opportunity for the person that you're working on to heal. also know that in the course, we're addressing the full body, and these different techniques will move to different places depending on the point of agitation or pain. But it's full body. You will learn how to do it completely with people, and with a little bit of practice, you will be surprised at what you see coming out of your work. If you're interested in learning how to do the subtle techniques, I have created a course that teaches my full body protocol for helping people out of pain and discomfort. This 10-video course takes you step by step so you can begin using these techniques.